Welcome back. I agree with the lady what she said, that people tend to regret after they eat lots of food. Actually, it is true, because myself, when I'm sitting on the table at futur time with some people, and they say that, why did we eat that much? We didn't have to do that. But then it's too late, right?
Yes, they regret when it's too late.
It's too late. So they should be cautious from the beginning, and they should try to cut down the portion and focus on healthy food.
Yeah.
What about pregnant women and breastfeeding mothers? Do you advise them to fast? And what are the conditions that they might be exempted from fasting?
It depends on the health condition of the pregnant woman. Actually, pregnant woman or any person with a specific health condition or specific situation, they have to go and consult their doctors and follow strictly their instructions. But usually, the healthy pregnant woman who doesn't suffer from any problem, and she's worried if she will fast, her baby will be affected. The baby will not be affected. The baby will get all the necessary nutrient through the umbilical cord from the body of the lady, of the woman, and she's supposed only to replenish, to compensate for what the baby is taking. And usually the portions baby is taking are very little. So do not overeat, and you can fast as long as you're not suffering or you're not having any special disease or special health condition. In this condition, we have to follow the instruction of the doctor. Now, for the breastfeeding woman, it depends again. If the baby is solely dependent on the breast milk, the breast milk will be reduced in Ramadan, especially daytime. It can be compensated during in iftar, during the night, at suhoor, but it will be less. So the woman should reconsider if she wants to keep on breastfeeding for her baby to be solely dependent on her milk, or she has to support him with other meals. But again, she can consult the physician of the baby. They will recommend again what she's supposed to do.
But both of them, they have to make sure, in case they decide to fast, that they are taking their good food, that they are taking their proteins, they are taking their calcium, their vitamins from the food properly and with the good portions, and make sure that they don't go into severe headaches or having side effects like being nauseated or vomiting or sometimes fainting. So these are the situations when the pregnant woman should consider breaking the fast if she's complaining of these symptoms, and if it's related to fasting.
Yeah, they have to make sure, or they have to understand and be aware that the baby, whether before delivery or after delivery, the baby is getting his needs from his mother. Now, the role of the mother is to compensate through healthy diet, good nutrients, in reasonable portions, to replenish what the baby is taking, and also to keep on a good health herself.
What about diabetic patients? Are they? Do you advise them to fast? What is the difference? Because we have diabetic patients type 1 and diabetic patients type 2.
Yes.
So people who are insulin dependent, do you advise them to fast?
Usually the people having diabetic conditions, type 1 diabetes, who are dependent on insulin, are not advised to fast. But recent study showed that around 43% of type 1 diabetic patients, they fast. And around 79% diabetic 2, type 2, they fast. But again, they have to consult their doctor and follow their instruction. These are critical health conditions, and we have to follow the instruction of the physician very strictly.
Well, Dr. Alia Dandashli, thank you very much for joining us today in Waves of Life, and thank you for the information you presented today, and we hope to meet again, inshallah, in future to discuss more about this.
Thank you, Dr. Muna, for hosting me, and I'm very happy to be your guest. And thank you again for the nice program.